My name is David Meinertz. I'm the co-founder and CEO of DrEd. We try to provide healthcare that fits into people's lives so they can get on with living. So what do we actually do? For over 50 conditions, we provide a very convenient and affordable way to get treated online. So patients access our service in a number of ways, via mobile, desktop, or laptop. They complete a condition-specific medical questionnaire. This questionnaire is reviewed by one of our doctors, and if suitable, our doctors will issue a prescription and send the prescription electronically or via paper to the patient or to a pharmacy. And these patients can then either pick up their medication from the pharmacy directly or get it delivered via courier or via UPS. We can't treat every single patient or every single condition, that's totally clear, but we've picked out about 50 conditions which we can safely diagnose and treat remotely without a face-to-face consultation and without a physical examination. That includes repeat prescription for long-term conditions such as asthma, blood pressure, or the contraceptive pill, but also something like malaria tablets or hay fever treatment, where our doctors can safely and efficiently prescribe remotely. We think we solve two problems. The main problem for our patients is we provide them with convenience, so they can use our service when and how they want it. They will receive a response very, very quickly, typically within the hour, from 8 to 8 on weekdays and from 8 to 6 during the weekend. And they will obtain their medications very quickly, either delivered or picked up in a nearby pharmacy. For doctors, we'll give them their time back. So typically our doctors can treat about 100 patients an hour. We think that's about 20 times more efficient than a normal GP in the surgery. We started doing this about 5 years ago, and we now operate in 6 markets. We are all based in London, a team of 75 with about 15 doctors, but we treat patients in the UK, in Ireland, in France, and in DACH. We operate under the DrEd brand in all of these markets, but we also operate a white label service, which is partnered with the Superdrug. It's called the Superdrug Online Doctor Service. It's a big chemist chain here in the UK with about 1,000 outlets and about 300 pharmacies. And we've provided, since our launch in 2011, about 900,000 consultations. We think we can get up to 1 million before year end. And typically, we now provide about 50,000 consultations per month, and about 10 or 11,000 are from patients in Germany, Austria, and Switzerland. We've been profitable since mid-2014, and we've grown the business quite significantly over the last 3 years. So you can see product market fit between 2012 and 2013. That was very painful. We only had about 10 patients a day, but that's significantly picked up over the last 2 to 3 years when we figured out the marketing and we made significant changes to the product. So we're now approaching on weekdays between 2,000 and 2,500 patients and consultations per day. So how can we actually do this? We have developed proprietary algorithms, which are condition-specific, which enable doctors to very quickly decide, yes, we can treat this patient remotely, no, we cannot, or we require further information. It's a batch process, so we call it asynchronous model of medicine. So patients can complete questionnaires when and how they want it, at work, on the way to work, over the weekend, and our doctors will receive the batch requests and can, with the help of our algorithms, very safely and efficiently decide we can and want to treat the patient remotely or not, or we need to refer the patient to a local colleague for further tests or diagnosis. Currently, our monetization model is as follows. Patients come to our website, pay for both the consultation and also the medicine. And this will typically range between 20 to 80 pounds, depending on the consultation and on the medicine. Our cost per acquisition depends on the market and on the channel. It averages around about £21, and within the first year, about half of all patients actually come back for to either obtain the same treatment or a different one. If we look at the market in the UK, and we think the market in the UK is about 15% of the European market, there are about 810 million prescriptions issued every year. Out of these 810 million prescriptions, we think about 320 million prescriptions can actually be issued remotely without direct contact with a patient. And we think the market will go to about 50 million online prescriptions in the UK alone. This year we'll treat about 500,000, so you can see across Germany, Austria, Switzerland, the UK, Ireland, and France. So you can see there's definitely room for growth for us and other competitors. In terms of where we're headed, currently we are based in London, but we treat patients in 6 markets. As I said, it's Germany, Austria, Switzerland, UK, Ireland, and France. The market in the UK is by far the most developed. This concept and this form of healthcare is available in the UK for the last 10 years. In Germany, we're market leaders and brought it really into Germany about 5 years ago. In France, it's basically the same. We believe that in the next 5 years, we want to go into the US, probably in 2017 or 18. And we will significantly extend the range of conditions we can treat remotely. Currently, we really focus on repeat prescriptions for already diagnosed conditions, but we think with improved technology, whether it's on the phone or data you can actually generate from mobile ECGs and so forth, and better tests, we can shift the focus from 50 conditions to about 150 conditions. All our patients pay our service privately currently. If they request it, receive an invoice, which they can then give to their insurance company, and they may get reimbursed. That predominantly happens in Germany. But we are moving towards a way where insurance companies want to work with us to provide that type of service to their customers for 2 reasons. Mainly, it's providing convenience to their customers, and it's reducing their costs. We, as I said, provide about 50,000 patients, 50,000 consultations per month, and we think we can grow our model to about 350 to 400,000, and our annual run rate at the moment is about £22 million of gross turnover, and we think we can grow it in the next 5 years to over 100 million. So in a nutshell, we use technology to basically do to healthcare what other industries have already done in e-commerce, in entertainment, in banking, and we help patients to access their doctor when and how they want it, and doctors to become significantly more efficient and reduce their costs by treating the patients via our platform. We do this not via video. We have a lot of competitors who focus on telephone and video, but we think the asynchronous model is the model which is really popular with patients because it gives them time back, and they can complete and give the information requested when and how they want it, and enables our doctors to look after patients both in a customized way, but also in a very cost-efficient way. The end product we deliver depends a little bit on the market. For some markets, we just send the prescription. In other markets where you can actually send prescription medicines via the post, the patient receives not only the prescription, but the medication directly. That's typically available in Germany and in the UK, but not in Ireland for regulatory reasons. And we are able to provide that kind of efficiency because we have developed condition-specific clinical guidelines with which our doctors can very efficiently diagnose and then decide whether or not the patient is they're able to treat the patients remotely. As a medical practice, we are registered in the UK with the Care Quality Commission, so everything we do is above board and according to clinical guidelines. And as I said, we operate this type of business under the DrEd brand in Germany, Austria, Switzerland, in the UK. and with a big commercial partner in the UK called Superdrug. That's it. Thank you.